Why does the hair fall happen?
There are many factors for hair fall, which starts from your diet, exercise if you're not doing, and healthy lifestyle. All those things has to be maintained. With that,
How do we identify the difference between the people like hair loss, thinning is happening, or it is going in the direction of baldness?
okay, if you see any shining place which is present already, then
People used to go to foreign for doing opting this hair transplant procedure.
for hair transplant, there's no need to go to a foreign country or anything like as you said, like Turkey is one of the thing which has that.
And how effective it is, like people may be scared of that this is a hair surgery and all.
Main thing is they get scared. Surgery is a word which makes them
It's a very costly procedure. So what is its starting range?
a smaller case starts from around and a bigger case goes up to. So there's a large gap in.
Hair straighteners, curlers and coloring permanently can damage your hair.
Yeah, 100% it can damage. There's no doubt on that.
Using onion or garlic on your scalp promotes the faster hair growth.
Nothing is
Hair transplants can be very painful procedures.
nothing.
Late night work schedules can accelerate your hair fall.
Yeah, 100% it will affect your health also on hair also.
Young people, even in their 20s, should not consider the hair transplant. Hey, hi everyone, welcome to the fourth episode of Rakhi Sharma Podchats. And today I'm here with all of you with the most requested podcast on Instagram survey. So, on Instagram, I have done one survey, and most of you requested for the doctor, hair transplant, and the skincare specialist. So, here I am with Dr. Ashrith, who is the plastic surgeon, expert in hair transplant and the skincare treatments. Today we are going to discuss about the very common issues that we all face, hair loss and the skin care. What's wrong with this generation? Why we are losing so much of hairs? And what is the hair transplant? Why it is so booming? Why people are going crazy about it? What is that exact procedure? What is the cost for that? And how effective long-term solution is that? What are the skincare treatments available in the market? What are the trends going on? And many more such things. Let's dive deep into this conversation. Thank you, Dr. Ashrith, for coming to the show. And can you introduce yourself to the wider audience?
Yeah. Hi, I'm Dr. Ashrith Iyanahally, board certified plastic surgeon at Avatar Lux. I head the surgical department at Avatar Lux, which is located at Koramangala STP.
Okay. And what all treatments you provide at Avatar Lux?
We have skin, hair, and plastic surgery. Everything from head to toe about plastic surgery we have here.
Okay, understood. So let's start from very basic questions. Why does the hair fall happens? We see that this generation specifically is facing the hair loss issues even from the 20s. So let's start from that.
There are many factors for hair fall, which starts from your diet, exercise if you're not doing, and healthy lifestyle. All those things has to be maintained. With that, you have genetic factor also. And it happens mainly, you've seen, means it's a receding pattern baldness always because this is of the hormone testosterone.
Okay. How do we identify the difference between the people like hair loss, thinning is happening, or it is going in the direction of baldness?
Okay, if you see any shining place which is present already, then it is an indication for hair transplant. If only a thinning of hair is present, they are not a candidate for hair transplant. There are many conservative methods which can be applied.
Okay. So we used to see that in earlier days, people used to go to foreign for doing opting this hair transplant procedure. But nowadays we see that normal people also going crazy after these treatments. So let's start from what is the hair transplant? What is this procedure and how effective?
How does it work? That's what.
Yeah.
For hair transplant, there's no need to go to a foreign country or anything like as you said, like Turkey is one of the thing which has that. So I'll explain you briefly about hair transplant, how it works, and for who is the candidate for hair transplant. Okay, if you see a bald and shining place on any person's head,
Mm-hmm.
there are no hair root means he is the ideal candidate for hair transplant. I have to make sure that he has a good donor area at the back. If good donor area is present, he is ideal candidate for hair transplant. In hair transplant, you have two methods. Majorly, we follow two methods. One is FUT method and the second one is FUE method. What is the difference between FUT and FUE is, if you ask me, in FUT a strip is taken and the hair is separated and then it's implanted. In FUE, we harvest single hair and then it's implanted.
Okay. And how effective it is, like people may be scared of that this is a hair surgery and all.
So those,
What are the side effects
but
and
they have to
complications?
make sure that they're getting operated by a certified surgeon.
Okay.
If someone is operated at home, I've heard people they come home and they operate hair transplant. All those things are risky. Always check your doctor's qualification, whether he's certified for do the surgery or not. If he's certified, he'll take all the precautionary and safety methods. So always go for a certified surgeon. Then complications rates are very, very, very minimal.
Okay. And we also hear from people that there's a very costly procedure. So what is its starting range
Price wise, it
for you?
depends on how much graft is needed or how many follicles are needed according to that, and what is the condition of the hospital, how hygienic they maintain. All those factors comes in. It is not like very expensive, it's affordable.
Okay. So what is this like starting range if we want to address somewhere? Yes, I was looking.
A smaller case starts from around 35-40,000 and a bigger case goes up to 2.5 lakhs also. There's a large gap in that. So
Okay.
it depends on what method we are using and what technique we are doing. Multiple factors are involved in that.
Okay. And if someone wants to do this procedure, how many sittings he'll require and how long duration he'll be able to see the results?
So how hair transplant works, I'll tell you. I'll tell you exactly. Once we do a transplant, takes around basic starts from around 4 to 8 hours. It might take depending on how many grafts or how many follicles we are putting. The day of surgery, he'll be under local anesthesia. He'll be comfortable talking to the doctor, and he'll have his lunch break. He can go have lunch. Everything is comfortable. Once the procedure is done, he can drive back and go home. That much safe it is. And once that is done, we'll do his head wash on the 7th day of the post hair transplant. Once the head wash is done, then the shedding phase will start. Whatever the hair we have put, it will start to fall. Only the roots will be surviving. Once hair fall start, post 3 months is the one when he starts seeing the growth phase. The hair will start to grow. That will go up to 6 months. So 6 months is from 6 months to 1 year, he is going to see the increase in density. So 10 months to 1 year is the one where he'll be seeing 100% the results. So he has to wait for it's just like I'll say all my patients that is like just like a normal pregnancy. You need minimum of 9 months.
Mm-hmm.
But
Understood. Yeah. And when people come to you, what are their common questions that they ask and they're scared about before going opting this procedure?
multiple questions they ask, as you said, like they don't know what is hair transplant.
Yeah.
First, I have to make them understand how safe it is and what is suitable for him. They say like that, sir, can I get head full of hair like you? This type of density is not possible in a hair transplant. It needs at least 2 sittings or 3 sittings of hair transplant to give this much of density. So I have to make them explain how it works and what is the density I'm going to put and how safe it is. And multiple questions they have like how many years it will stay and is it permanent. So they should understand the concept of hair transplant. Whatever we harvest from the permanent zone, it will be almost permanent.
Okay.
So if you are going above the permanent zone and below the permanent zone, that will thin away after maybe 5 to 8 years.
Okay. So this hair transplant will long for 5 to 8 years, you're saying?
What I'm saying is like whatever we harvested from the permanent zone, it's going to be permanent.
Oh,
But everything cannot be harvested only in the permanent zone. Some places we have to go above and some places we have to go below. So at that time, it will thin away in 8 to 10 years.
okay. And we also hear that people take the hairs from the beard and other areas. So how effective that is also?
Beard hair transplant also can be done and chest hair can be taken and a pubic hair also can be used for hair transplant.
Okay.
Those are also the multiple options.
So before opting the like this is the extreme stage of hair. So before that, can we take any preventions, precautions?
Okay.
Well,
Eight preventions or precautions, as you're saying. First, healthy lifestyle is always the thing for because that's the main engine.
correct.
Your body is the main engine. Once that is clean, everything will be good. So healthy lifestyle is always good and avoid stress and have a good lifestyle and food should be very good.
Okay.
Food diet should be proper. That is very important. With that, you add with multivitamins for hair, which helps. That's also a good thing. You can add multivitamins. And yeah, that's it. Avoid all those keratin treatments or hair straightening, pulling.
Okay.
All those cause trauma to the hair. Every day you're pulling or straightening that much of pressure, it will come off. So avoid all those.
Okay.
Mm.
But people say that like using the gel and the serums, like it is just on the length of the hair, not the root. So
Correct.
does it still damage the hairs?
Root, don't touch the root. That's it. Root is the one where it grows. So
Mm.
don't touch the root. Outside, like the external things, you can do it. But again, straightening, if you're pulling it, it goes to the root back.
Okay. How often we can like you recommend doing straightening if someone wants to do it?
So if you get straightening regularly, it'll come back to me again.
Okay. And like we hear about a lot of like the oils, Adivasi oil and methi ka dana yeah, a lot of things, hibiscus, lot of nuskas we try as a remedy at home. So what is your opinion about
If you have tried this, you can say, I've never seen any effect in all those. And I don't say that it is not effective also. I would say like, you can't expect results in such things. Only thing is just to pamper your skin or get a head massage, you can get it done.
Okay, okay. And oil, people recommend that you should daily oil your hairs before head wash. So what do you recommend that before going to?
No restrictions on oil. They can use it. It doesn't harm you or it doesn't give any advantage.
Okay,
So it's neutral.
okay. I heard in some of the podcasts that people get fungus because if they put oil for
That is good.
overnight.
That's good. After putting oiling, it has to be properly cleaned and dried. If
Okay,
you're not cleaning it properly, if you're not maintaining a hygiene, then chances of infection, fungal infection are always there.
okay,
So after post oiling, hygiene has to be maintained.
okay. And when we go to the marketing products like anti-dandruff shampoos and that, so what we should avoid, like which factors should not be in that shampoo that so that we should avoid?
Sulfur free, that's what I would say. And anti-dandruff, you need, if you have a dandruff, then only go for anti-dandruff shampoo or else it's not required.
Oh,
The regular basic sulfur free shampoo, chemical free, as much as possible, you can use it.
okay, understood. So how does the diet and the protein supplements that people take can affect their health of hairs?
Anything which you take over is going to affect. Like if you are in limit, it's not going to affect you. Protein supplements, many people come to me who go for gym and all, they say like extra proteins they are taking. That's harmful for your body. Not only in hair is what you're seeing, that's it. But if you get a liver function test, if you get a kidney function test, you can see there also. Only thing is you can't see liver and kidney, that's why you're not getting to know. Here you can see, that's why you're saying hair loss is there.
Okay.
But if you get your liver function and renal function test, then you'll get to know the status of that also. So avoid anything taking it over.
Okay.
Whatever is required for your body, that much you take.
Okay. We also hear that people take minoxidil, finasteride, and maybe without prescription also. So what are those treatments? Can you elaborate?
Minoxidil and finasteride both are approved drug by FDA for a hair loss. That's the approved drug. But it should not be taken over the counter. It has to be guided by a doctor's prescription.
Okay.
Because it has to be dose adjusted. It is not like that he just goes by in a medical shop, I need minoxidil. It doesn't work like that. So it has to be dose adjusted. So always go with a doctor's prescription for the minoxidil.
Okay. Any side effects of that? We hear a lot of side effects also.
Minoxidil side effects are like, I would say, whenever they're using, they'll be very happy. Once they start using, they'll see the difference. It does given good growth for hair. But only thing they complain is like they have scalp dryness, itching. That is there. So if they started minoxidil, they have to continue it for lifelong. That is what it is. If they stop it, again, it is just like increasing the blood supply for your scalp and reducing it immediately. So your scalp hair is not going to survive. So if he has started, he has to continue it. That is what the main thing with
Okay.
minoxidil.
Understood. And we hear about the advanced treatments like PRP, GFC. Can you tell about that? Who can opt for that?
PRP, GFC has become common treatment now. Above that is like exosome stem cells therapy has come. So I'll brief you how PRP and GFC works. Like in anything like PRP or GFC, we draw your own blood and plasma is collected. And in GFC, a growth factor is added in there. So and then it's injected over your scalp area so that it gets the local nutrition for the hair. And it helps to improve the quality of hair. It's not going to bring you a new follicle, but it's going to improve the quality of hair and it will reduce the fall rate of hair. Delaying your baldness, that's all. You're not like permanently removing your baldness, you're delaying your baldness in there. So if your baldness has to happen in 3 years, means it prolong it to 5 years.
Okay.
With taking all these precautions.
And if we stop taking this treatment, will it reverse to that?
It might not reverse fully back to that, but it will thin out.
Okay.
It will thin out.
Understood. Yeah. So, Dr. Ashrith, can you walk us through the hair transplant journey step by step?
Okay, how any clients or any patient who wants to take a hair transplant, I'll tell them in their point of view how the hair transplant works. So the main reason who comes to me for a hair transplant is because they have lost a hairline and hairline has been receded. That is on the appearance. But the main thing is for their self-confidence, because it loses a lot of confidence to receding hairline will lose their confidence. That is the main reason they will come. So in a hair transplant journey is very simple journey and it's safe and effective method also. It's proved. Like many of my clients are very happy because of the same. I'll tell you how hair transplant works. So in a hair transplant, first you should know what is follicle and what is graft, which is very important. So follicle means a single hair will be present with a single root. That is called as a follicle. If 2 or 3, if you can see in the microscopic region, like you can get to know there are sometimes 2 follicles or 3 follicles together, which is called as graft. So that is the difference between a follicle and a graft. So it is almost equivalent to one follicle to one graft is equal to 1.9 follicles or 2.2 follicles, which we consider as like 2500 graft means we'll say it as 5000 follicles. So that is the difference between a follicle and a graft. So once you understand that, then we have to see how much of follicles is required. So why follicles is important is, for as a plastic surgeon, we have to put single follicles in the front line. If I put 2 to 3 hairs, which is meant to say as a graft in the front, it looks very unnatural. It won't give a natural appearance. So that's why I always calculate in follicles. So we use single follicles in the front. As we go back, then we use double and triple.
Okay.
Okay. So once he comes, so I'll consult him. I'll see his hairline, how much it has receded, and I'll check his donor area, how much graft is required. According to that, we'll go ahead. Once we decide as a consultation with him, once he is counseled about the hair transplant, we get his blood investigations done. I'll walk him through all the journey. Once blood investigations are done, once he is fit for the procedure, then we plan his procedure. So on the procedure day, it takes around, if you say consider it as 5000 follicles, it takes around 4 to 5 hours of the procedure time. How we start the procedure? Morning around 9:30, 10, if we start the procedure, he can have his breakfast and come. Once we in the OT, we will give his tetanus injection and his ilocaine test patch is done. Once he is go through that, his vitals are checked, that is pulse, BP, everything is checked, SpO2. Once we assess his all the physical examination, he is fit for the surgery means we will take him inside the operation theatre. And at that time, a local anesthesia is given. Only thing, they say many people will say that hair transplant is very painful. We cannot talk. Only thing is slight pain he has to tolerate for first 5 minutes. If he tolerates that, over a period of 4 to 6 hours, he will be very comfortable.
And he's awake during.
He is awake, he will be talking to me at the time of surgery. He can watch a movie also. We usually play a movie in our operation theatre so that because it's a long procedure, 4 hours, we'll also be relaxed at that time. We'll be watching a movie at that time.
And how many people operate for the one person?
So we need a team. Hair transplant is not individual thing. It's a team. Because at least I have a team of 5 to 6 people.
Okay.
So it will be operated under my guidance.
Okay. Understood.
So once in the OT, we start the procedure. He'll be, there are 3 steps in this. One is extraction of the follicles from back. And when we make a slits in the front, that is called as slitting. And then the third stage is implantation. So first we do the extraction process from the back. In that, there are again 2 methods. One is known as FUT method and the second one is known as FUE method. Follicular unit transfer or follicular unit extraction. What is the difference between that is, in follicular unit transfer, a strip of skin with hair is taken from the permanent zone. And then it is slivered, hairs are slivered into single follicles, and then the same continues with the other stages. So in FUE method, what we do is a single follicle is taken with the help of punch. If it is a hair, it goes and then takes out. We'll take the hair. So it is known as FUE method because single hair is taken. In FUT, a whole strip is taken. That is the main difference.
How do you suggest them that they should go for FUT or FUE? Okay.
So see, it depends on the patient. FUT, in the FUT method, the only disadvantage is they'll have a scarring this. But it can be covered with the hair. That is the thing. But this is from the permanent zone. If you ask me, FE is also safe, FUT is also safe. When we need more number of follicles, like I'll say like 12,000 or 10,000 plus follicles at that time, we'll go for combination method. I'll do a FUT also and above and below I'll do a FE also. So that is combination method. So both can be considered at that time. So once the transplant is done, extraction is done, then we'll count the grafts. Count the grafts and follicles. We separate it to single follicles, 2 follicles and 3 follicles. So we'll separate like that so that in the same pattern we can arrange in the front. Then what we do is, then patient will be lying in the supine position. Then we'll do the implantation. So first a slitting is done, use of sapphire blades. So those are the best blades what you have in the market and you can give a high density with that. So we use sapphire blade technique and the slitting is done in that area. Once that is done, a implantation is started with a keep implanter. So we have imported this from a Turkey. So it's called as keep implanter. That's why it won't leave you any scars on the scalp. If you've seen other persons or anyone result, you can notice something is coming out like the skin. So those are scars. All those things will be avoided in keep implanter usage. So once that is done, once 4 hours is done, he is fit to go back home. There is no downtime or anything. Only thing is slight swelling he'll have, and he won't have a social appearance won't be there for him for a couple of days. That he should accept. But he can work from home, desk work, everything can be carried out. There is no restrictions on that.
Okay.
And post care, we'll put him on antibiotic for around 5 days and a painkiller for 2 to 3 days. If he has pain, or else not necessary also. Or else that's it, like multivitamin for a hair he has to take. And after that, I would advise to take GFC sessions or a PRB sessions, minimum of around 4 sessions monthly once. Not for the transplanted hair exactly, mainly for the rest of his hair he needs. This will be present, but for the rest of hair will get thin. That is the reason he has to take.
Okay, understood. Thank you so much for explaining in brief about the hair transplant. So I also want to ask that only the men can go for this procedure, or is it applicable for women also?
For female, they also have the main disadvantage with female hair transplant is the thing is they have a diffuse pattern baldness. If you are seeing any female, it is like a not like in the front, it won't be receded, but they'll have some hair here, some hair here, some hair here. We can do a hair transplant for females. It is not like contraindicated or anything, but they should have a realistic expectation, because there is always chances when in a males it is always an empty feed. Whatever we put, it is going to come. But in females, what happens? There is hair in between this. So whenever I'm putting one, I might damage. I'll make sure that I'm not damaging, but still the roots are present like this inside. So there are chances of damage. Though they should know the realistic expectation. Women's also get the hair transplant done. Many have operated for females also. And for them, there is option of synthetic hair also. And for them to grow hair so long, it is downtime is like 3 to 4 years. They say this much long I want. So all those things, realistic expectation should be there.
Okay, and you mentioned about the synthetic hair. Can you explain about that?
Synthetic hair is a newer topic in South India. We are the only one. We are doing at Avatar Lux. In South India at present, we are the only one for doing. The synthetic hair is mainly two types are present. One is biofiber and second one is Nido. So biofiber is from Italy and Nido is from Japan. So here the hair is readily prepared in labs and it comes in a packet in a sterile container. So that is directly implanted in the scalp. This is not advised for everyone who don't have donor area, or as you said in females who don't have downtime for those. For them it is advised.
Okay, so any side effects of that because it is implanted in our hair? So
Yeah, see, always I would advise a natural hair because this is of your own and it grows with it. And it gets its blood supply and it survives. So this is your own hair. So always there is no side effects in natural hair transplant. Yeah, in synthetic hair, as it is a foreign body, there are chances of slight infection. You can get a folliculitis. How you get acne over the face, like that you can get over the scalp. That's why we do a test patch of around 300. Once that is accepted, the body accepts that hair, then only we'll go with more numbers. And you'll have around 15 to 20% of shedding of synthetic hair every year also, because the body try to reject it.
And how long that solution will long?
If you get 1,000 hairs, it will stay up to 4 years.
Okay,
Every year, if you deduct around 15 to 20%.
okay, understood. Still, it can be done.
Yeah, it can be done. Like, who don't have a donor? Because I have seen many females, they have tried hair transplant and they are not comfortable with cosmetic wigs because it's not free for them and it hampers their confidence. For them, it's a good choice.
Okay, understood. Yeah. So we see a lot of doctors in the market. So how one can differentiate between the right one for them?
So you're asking about hair transplant means always the first preference should be a board certified plastic surgeon. He knows how to create the hairline. He knows the safety, what safety measures he has to take. The second option should be a MD dermatologist who is qualified for doing a plastic surgeon. I would say like that is the last thing you should go with.
Okay, understood. And what's the one piece of advice you would like to give to the audience who is in the dilemma of whether they should opt for it or not?
See, hair transplant is a safe and simple procedure. If they have any doubts or anything feeling, main thing is they get scared. Surgery is a word which makes them scared.
Exactly.
So don't get scared about that. Feel free to contact me. I'll help them more. I'll be very happy to help them.
Okay. Can you tell audience about where this Avatar Lux is and how they can reach out to you?
Avatar Lux is present at Kormangla in ST Bed near the Wipro Park signal. Here we deal with all plastic surgeries and cosmetic surgery from hair transplant, breast implant, liposuction, mommy makeover, all fillers, botox, everything is available at Avatar Lux. If you have any need of plastic surgery or hair transplant, please feel free to contact on the below number.
Thank you for explaining briefly about the hair transplant procedure. But the main question remains same, that when they can see the actual results of the procedure.
So yeah, I stopped it at the OT level. I'll explain you how post journey of a hair transplant works. So once a procedure is done, he is fit to go for his work. Everything he can carry out his regular exercise, activities, everything can be done. Gym, everything can be done. There is no restrictions on all those. Once it is done, post our hair transplant, till 2.5 months, he will have shedding phase. Whatever hair we have put will fall off. The roots only will be surviving. So at that time, he should not get tense that, oh, nothing is there, like that. At that time, he'll feel like, oh, I've got small hairs, but I'm losing it now. That type of feel should not be there. Post 3 months is when the hair will start to grow. At 6 months, you can see the dramatic difference in his face look. Everything would have been changed by 6 months. And from 6 months to 9 months is when there will be increase in density. So at that time, 9 month is the one where he'll be very happy at that time, seeing almost like 80 to 100% of the result he'll be seen at 9 months. He can wait up to 1 year. 9 months is like almost all the results would have been seen.
Okay, okay. And how do you see the people who have already achieved the results? What are their reactions?
So their face look changes and they'll be so happy. And every time they come with sweets, everything to clinic. So that's a different feel only.
Okay.
And they get their confidence with all those. So
Yes.
they'll be very happy with it.
Okay. So we have discussed about the hair transplant procedure, synthetic hairs. But what if someone is not having the good donor area? What are the other alternatives for this procedures?
Other alternatives are like if you don't have a good donor area, he can opt for a synthetic hair. As I explained you, there is one of the good advantages he has in that. The next non-surgical approach will be a cosmetic patch, which we call it as a hair system. In that it is not a wig type of or anything. It is usually customized according to your hair requirement. So we'll take a sample of your hair and then the match will be done with your cosmetic patches, the hair system. And according to that, it will be customized and what is the density required. So it should look very natural. That's why if you ask me, many actors, many are on cosmetic wigs.
Yes, yes. We see the Amitabh Bachchan wearing the wig.
Many are on
A lot.
cosmetic wig. They shows how they style their hair, everything. So many people are comfortable with cosmetic patches or hair system also. So in that also many from basic to advanced type of wigs are also available, where we call it as Swiss lace, French lace, and single follicles. Multiple things are options are available in there.
Okay. And how long it can work?
He can use it for lifelong.
Well, any side effects, complications?
Side effects as such. This is a non-surgical method. Now you are replacing a wig over here.
Just
Only thing is he has to get his refusions done. So every month he has to remove it and get the hair trim, whatever is present, and then again paste it with a medicated glue.
But when you paste it with the medical glue, so does that area get damaged?
So we have to use a medicated glue.
Oh.
If using a regular glue, it's going to damage.
Okay, okay, okay. And what about the wig? Is it the same?
So Wix upgraded version or hair system, which is customized. Wix is a common term used,
Okay,
but Wix upgraded version or a hair system, which is customized for your needs.
understood. Okay. So thank you, Dr. Ashrith, for explaining each and everything in detail about the hair transplant and hair loss system. So next we are going to play a myth and truth round. So I'll ask you one question and you can just give in short answer for that. So does washing your hair on the second day of periods cause more hair loss? Is that a myth?
It's a very big false. There's no concept as such there.
Okay.
I don't know how someone asked you that question or like.
Maybe at home, like from the tradition, ancient people says that. So
Nothing related.
nothing. Okay. Applying oil to your hair regularly can completely stop hair fall.
Nothing, it's not a myth or fact also. Like, I would say it as like hair oil is not useless also, not useful also. It's going to just give a hydration for your scalp.
Okay. Hair straighteners, curlers, and coloring permanently can damage your hair.
Yeah, 100% it can damage. There's no doubt on that.
Okay. Laser hair removal is harmful to the skin in long term.
It's not harmful to the skin, but it should be avoided sometimes, such as when your pregnancy is present or breastfeeding at that time, it should be avoided.
Okay. Using onion or garlic on your scalp promotes the faster hair growth.
Nothing is proved.
Okay. Eating protein powder can lead to hair loss.
Heavy overeating of protein powder might cause.
Okay. Hair transplants can be very painful procedures.
Nothing as such. Hair transplant is safe and painless. I won't say it as a painless. Just hardly 5 minutes you have to tolerate pain. After that, it's pain free.
Okay. White hair in the beard is only because of aging.
Correct. That's because of aging only. White hair is because of aging, and it cannot be with serums and all. It cannot return back to black.
Black.
If anything you find like that, you can let me know.
Okay. Fairness treatments can lighten your skin permanently.
Not permanently, yeah, it do lighten. Fairness treatment such as medically approved fairness treatment, not like Fair and Lovely cream or not like, no, I don't want to take the name, not like over-the-counter products, but medically approved can give you a glow.
Okay. Late night work schedules can accelerate your hair fall.
Yeah, 100%. It will affect your health also and hair also.
Okay. Korean skincare routines are more effective than the other methods.
These are all marketing things. Same drug will be used, the different name will be given. This.
Okay. Young people, even in their 20s, should not consider the hair transplant.
Yeah. Before 20 years, I won't advise to consider for a hair transplant. That understand why it is lost. The main cause for it we have to be found out. Then only we can go ahead with the treatment. Post 20 or 21, I would advise they can go for a hair transplant.
Okay. You can determine the cause of hair fall through the medical test.
Yeah. Multiple causes are present like vitamin deficiency of D, B12, and any hormonal imbalance. All those are the causes which we can get to know through blood test.
Okay. Botox and fillers are only for women.
Nothing else. Many actors are also on Botox and fillers.
Correct. Skin treatments like chemical peels and facials can completely cure your acne.
Cannot completely clear your acne or anything. Acne, what is the cause for acne has to be found out. It will reduce 100%.
Okay. Yeah. That's it for the day. Thank you so much. Thank you for watching this whole show and getting each and every detail about the hair transplant. If you are considering taking a first step today for the hair transplant, do not hesitate to reach out right certified people in this industry. And I can share the details of Avatar Lux in the below description. You can reach out to doctor anytime. Thank you, Dr. Ashrith, for coming to the show. And today I've got a very wonderful insights from you. My truths and the myths got cleared. Thank you so much for coming.
Thank you for inviting me here. I'm very happy that at least people who are watching this will get to know about what are the facts of hair transplant and it is very safe. That's what I wanted to convey them. At least it will reach out to the good audience. That's what I wanted. Thank you.